Today topic of discussion thalassemia. Thalassemia is the quantitative abnormalities of the globin chain. So the globin chain are normal in structure, but their synthesis is less. So sometimes may be zero, sometimes is reduced, sometimes it may be zero. Uh, so here structure is normal, synthesis is zero. Okay, so that one. So there are two type of globin chain in uh, hemoglobin. Hemoglobin A we have hemoglobin A we have 2 alpha, 2 beta. So there are two type of thalassemia. If this alpha is absent or less, okay, if this alpha is less or absent, it is alpha thalassemia. If that beta is less or absent means beta thalassemia. So in alpha thalassemia there is reduced synthesis or total absence of alpha chain. In beta thalassemia there is reduced synthesis or total absence of beta chain. So alpha chain absent means alpha thalassemia, beta chain absent or less synthesis means beta thalassemia. Now, where are the chromosome are located for alpha chain? The chromosome and the gene for alpha chain is located on chromosome number 16 and the gene for beta chain is located on chromosome number 11. So we can see 2 alpha, 2 beta. Now we can see if alpha is absent or reduced. So beta will be there. The beta will be relatively more than alpha. So it is known as alpha thalassemia. If the beta is less or reduced, so alpha will be relatively more, it is known as beta thalassemia. Classification of thalassemia. Alpha thalassemia are 4 types. First one is hydrops fetalis, then hemoglobin H. Third one is alpha thalassemia trade. Then fourth one is alpha thalassemia carrier. The classification of beta thalassemia major, intermediate and minor. We will discuss one by one. Started with beta thalassemia in detail first. The problem is with the beta chain of globulin. The beta chain is either less or totally zero. It is known as beta thalassemia. So the beta chain absent, either it is reduced or absent. So HbA cannot formed because for the formation of Hb we required 2 alpha 2 beta. So HbA will not form. Here it required 2 alpha 2 beta. Now alpha is there but beta is not there. So how HbA will be formed? So that HbA will not formed. That is the problem with beta thalassemia. That is the introduction. What is the molecular pathogenesis? The extract mechanism which is taking place because of which beta chain is not forming. So the gene of the beta chain is located on chromosome number 11. So chromosome number 11. On chromosome number 11, there can be a point mutation. Here point mutation. There can be splicing mutation. So here splicing mutation, there can be termination mutation, there can be promoter mutation, any of them or all of them are point mutation. So most common is splicing. On the formation of HB, we required 2 alpha, 2 beta. Now alpha is there but beta is not there. So how HBA will be formed? HBA will not formed. That is the problem with beta thalassemia. Now what is the molecular pathogenesis? The extra mutation which is taking place because of which the beta chain is not forming. So the gene for beta chain is located on chromosome number 11. On chromosome number 11, there can be point mutation. So this one is the human cell. Here it having nucleus, it having chromosomes. Chromosome number 11 can be point mutation. There can be that splicing mutation, or there can be termination mutation, or there can be promoter mutation. Any of them or all of them point mutations. Point mutation, most common is the splicing one. Splicing mutation is the most common one to reduce the synthesis or zero synthesis of beta chain. So in human cell, the nucleus of human cell, it containing 46 chromosome or 20 pair of chromosome, number 1 2 3 like that. Here chromosome number 11, okay, that pair number 11, the gene of that beta chain gene, the gene is having some point mutation. One of the point mutation, whether splicing, whether promoter, or whether terminator, that is causing reduced or absence of synthesis of beta chain. So we can learn the molecular pathogenesis. It is point mutation. Here point mutation. Now there are 3 types of that: beta thalassemia, major, intermediate and minor. In major, there is complete absence, the complete absence of HBA, complete absence of beta chain. So HBA is nearly 0. So maximum HB is HBF. Okay, here HBA 0, maximum here presented HBF. What is HBF? Alpha 2 comma 2. Now beta, we know alpha 2 comma 2. Alpha 2 beta 2. Now this beta is absent, it will, okay, so beta is absent. Now alpha is normal, but normally alpha bind with beta and it form HBA. So it form HBA, but now beta is absent. So with whom that alpha will bind with gamma, and because of which HBF will be formed. So alpha will bind with gamma, then it form HBF. So HBA is absent. Absent, reduced. HBF normally less than, normal means 1%. Now it is will be more, it can be 98%. Previously less than 1% only normally HBF, now 98%. Major is beta thalassemia. Normally, alpha bind with beta to form HB. Alpha bind with here comma, so form HBF. So HBF level increasing more than 98%. So two genes, here one gene and here one gene. These both are mutated. So on chromosome number 11, we have a pair of chromosome number 11. On each chromosome, we have one gene of that beta. Okay, beta, one gene of that beta, one gene here, one gene here. Here the point mutation is in them that leads to beta thalassemia. So both gene are mutated. This is one also. So both gene are mutated. Both genes are mutated. This one also, this one also. That is trade. Trade is beta. Trade is beta thal. Two genes presented on chromosome number 11, both are mutated, so that one leading to formation of HbF. So there is zero beta chain or very less beta chain, so alpha will bind with gamma leading to formation of HbF. In severe anemia requiring very frequent blood transfusions since birth, so very frequent, very frequent, every week or twice a week or every 15 days blood transfusion is required depending on that percentage of HbA which can be synthesized, and lesser the percentage of HbA, more frequent is the blood transfusion required. The second is intermediate. Second one is intermediate. Intermediate having multiple mechanism can be there. Here anemia severe, but blood transfusion is not required very frequently. As major, it is in between major and minor. Next one is minor. Minor are usually asymptomatic. One gene is normal, one gene are mutated. One gene is normal, one gene are mutated. So A2 is 4 to 9 percentage and HbF is 1 to 5 percentage, and the major HB is still HbA. So they are usually asymptomatic. That is the third type, beta thalassemia. Now coming to clinical features of beta thalassemia, major, intermediate and minor, both are asymptomatic only. So major, we have to understand that clinical features. Now beta is absent. Beta is absent. So what does that alpha will do? Alpha will form complex with gamma. Alpha to gamma 2. Alpha to gamma 2. Because beta is absent, normally alpha bind with beta to form HbA. But since beta is absent, alpha will bind with gamma to form HbF. Number 2, RBC containing only alpha. Such RBC are destroyed. Ineffective erythropoiesis. Ineffective erythropoiesis takes place leading to anemia. Because of anemia, the erythropoietin in that renal tissue will be more, so there will be more iron absorption, and because of the frequent blood transfusion you will give frequent blood transfusion. So frequent blood transfusion to the person. Now the blood transfusion is very frequent in very frequent. Whenever there is frequent blood transfusion, the most main problem here, the iron overload. So because iron is also going every blood transfusion, now you cannot give only globulin. Along with the globulin you will give heme also, but patient don't record heme. Patient record only globulin only, not record heme. Patient record only globulin. Patient not record heme. You will give complete hemoglobin in that RBC in blood transfusion. So the heme will accumulated in that form of iron. So such patient which record very frequently blood transfusion, they have iron overload, and that is the cause of death. The iron overload will deposit in various organs, the heart, the pancreas, the kidney, causing the failure of that organ and leading to death. And to compensate that bone marrow, okay, capacity, the medullary, that bone marrow cavity, the medullary cavity will expand. So here organ failure, what will happen simultaneously? Compensate that bone marrow cavity, the medullary cavity will expand. So that is the clinical features. So patient have anemia, hepatosplenomegaly for extra medullary hematophysis to compensate that bone marrow will expand. So they typically have thalassemic phase. Okay, so they have thalassemic phase. You can see that medullary bone or facial bone, and it expanding. Why this one is why expanding? To compensate to form more and more RBC, because they are losing, they are lost. And iron overload can be there because of repeated blood transfusion. Every time heme is also coming, we don't record heme is converted into iron and damage the liver, heart, and causing death. So that can be the problem. So clinical features: anemia, hepatosplenomegaly, expansions of bone, and iron overload. These are the problems. Now coming to laboratory diagnosis of beta thalassemia major. How will do the laboratory diagnosis? You can make a peripheral smear. You will get microcystic hypochromic anemia. We can compare the size of RBC with a lymphocytes. RBC are smaller and they have less color. The center pallor is expand, and hardly we can see the HB at that periphery. So microtic hypochromic RBC, there is variation in shape of RBC. So anisocytosis, picocytosis, some of them are targeted cell, and basophilic stifling is also common in thalassemia. So that is the peripheral blood picture. Second one is bone marrow. Major, we can see thalassemia major in bone marrow, seeing it's hypercellular because of compensation, and the myeloid ratio is reversed. Myeloid is less, erythroid is more. Next one is osmotic fragility test. It is very important to understand here. The osmotic fragility is decreased. They become more stable here. That RBC become normal. RBC containing alpha 2 beta 2, they are fragile at a sudden extent, but RBC will don't have beta, they have alpha 2 gamma 2, they are more stable. So basically the fragility is decreased. So this one is the normal range. Here that fragility decreased. They are not fragile, the fragility is decreased. So you can see osmotic fragility. This one is the normal range. in between two lines it is the normal range, so that osmotic fragility is increased in hereditary spirocytosis but decreased in thalassemia. This one will increase here, thalassemia condition will decrease. Now special test. Now special test for thalassemia, Nestroff test. Full form: naked eye single tube red cell osmotic fragility test. Naked eye single tube red cell osmotic fragility test. That is the full form of Nestraf. That is a typically performed as thalassemia. It is a screening test of thalassemia. So what basically we supposed to do, take here, we will take two test tube. We can take the blood of thalassemia patient in one test tube, and we can take control, that means normal individual blood, not anemic. So you can see the two test tube. One test tube normal person, another one is that one is the control, another one is thalassemic blood. In both of them you are adding 0.35 percentage of saline. Both of them you are adding 0.3 percentage of saline. The control will undergo hemolysis, so this one will undergo, nor control will undergo hemolysis. The healthy individual RBC present inside that RBC, they will undergo hemolysis. They all will undergo hemolysis, but the thalassemia RBC will not undergo hemolysis because the thalassemia, that osmotic fragility is reduced. So at 33.5 percentage of saline, they will not fragile. Now behind the test tube put a black lined white paper. Can you see that behind? Okay, back side lined white paper we can kept there. White paper behind the test tube, make the black line on that, and the black line we can see front, okay, in that control we can see that line in that control, but here we cannot. That black line lies, okay. So because RBC are ruptured, but that, so we take two test tube to put a 0.35 percentage of saline, wait for 30 minutes. After that put a white paper with a black line on that RBC in control, they undergo hemolysis. So black line is visible, but RBC, the in thalassemia, they are resistant to 0.35 percentage of saline, so they will not undergo lysis. The black line is not clearly visible. That is the test, Nestroff test. Coming to hemoglobin electrophoresis. In electrophoresis, we will get maximum hemoglobin is HbA2 and F. HbA is either completely absent or very less. So that is hemoglobin electrophoresis. We can see the X-ray of the skull, X-ray of that skull, in which you can getting typical cork. Okay, so here we can see that cork, crooked appearance or hand on end appearance. So both the meaning of same. It is due to expansion of that marrow cavity in the skull. Expansion of that marrow cavity in the skull. The marrow cavity get expand, giving this appearance. This is known as crooked appearance or hand on end appearance. So that is all about beta thalassemia. Coming to alpha thalassemia. What is alpha thalassemia? Now beta chain is normal. Beta chain is normal. Okay. Alpha is absent. Either it absent or reduced. So again HBA cannot formed because for formation of HBA we required 2 alpha 2 beta. Okay, but in beta thalassemia the beta was absent. In alpha thalassemia alpha is absent. Either is alpha is absent or reduced production. That the molecular pathogenesis, there is deduction of one or more alpha chain presented on chromosome number 16. The human cell, the nucleus of human cell, it containing 46 chromosome or 23 pair of chromosome among 24 number 1, 2, 3, 4. Here chromosome number 16. Okay, there are 4 gene alpha 2 on each chromosome. So all the healthy individual have 4 alpha gene. Okay, 1, 2, 3, 4, like that 4 gene is presented. Now there are 4 type of thalassemia. If one gene is deleted, name is called as trade. 2 gene, okay, 2 gene is deleted, that name is called as carrier. 3 genes is deleted means HPH disease. 4 gene is deleted means that condition name is called hydrops fetalis. Hydrops fetalis. So that is the classification. Here not point mutation. Chromosome number 11, there is a pair of chromosome number 11. This is chromosome number 16. Chromosome number 11, beta thalassemia. Only 2 gene presented in beta. This is beta thalassemia. Alpha thalassemia presented in chromosome number 16. 4 gene are presented. 2 on each chromosome. 2 on each chromosome. Here is point mutation leading to beta thalassemia, but here deletion of them. Alpha deletion of 1, deletion of 2, deletion of 3, deletion of 4. So 4 type of alpha thalassemia, that is the basic. The basic is the point mutation in chromosome number 11. The beta gene leading to beta thalassemia, and deletion on chromosome number 16, that alpha gene leading to alpha thalassemia. So beta thalassemia is due to point mutation. Alpha thalassemia is due to deletion. That is the molecular pathogenesis. So 4 type. One of them is deleted. One gene is deleted means alpha thalassemia trade. 2 gene deleted means carrier alpha thalassemia. 3 means hypertrophy. This one 3 means HPH disease. 4 gene deleted means hydrops fetalis. 4 gene deletion means hydrops fetalis. 3 gene deletion means HPH disease. This one 2 gene deletion means alpha thalassemia trade, mild anemic. This one is the asymptomatic one, alpha thalassemic carrier. So what will happen? Alpha chain is not produced, so formation of beta and gamma chain is normal. So here beta will form normally 2 alpha 2 beta, but now alpha is absent. 3 of them deleted. Okay, alpha is absent, so beta will form tetramer. It is known as hemoglobin H. Beta will form tetramer, that name is called as hemoglobin H, it is an abnormal hemoglobin known as HbH. HbH have high affinity for oxygen. It will trap that oxygen and will not leave that oxygen, leading to hemolytic anemias. It will be trapped in that, okay, it will be trapped in that spleen, that is HbH. Alpha is absent, gamma is forming tetramer, it is known as part HB. The tetramer of that beta here, tetramer of that gamma here. Because alpha is absent, now alpha is absent, so either the beta will form the tetramer or gamma will form the tetramer. It's HBB. HBB here also oxygen affinity is high, will leads to intrauterine death. It is known as hydrophytalis. The fetus stillbirth or intrauterine death of that fetus, that is hydrophytalis. So 3 genes deleted here, 4 genes deleted here. So most severe in this part HB. Second one is HbH. So HbH, it is moderately severe anemia, required occasional blood transfusion, but hydrophytal is most dangerous here. 3 genes are deleted, 4 genes are deleted here. This one is the most dangerous form of beta hemoglobin is formed. So finally, HbH is the disease is formed, the tetramer of beta, hemoglobin that part is formed, tetramer of gamma. Thanks for watching.